to DSGN View. Here we examine the obstacles combating our nation and we consciously think out of the box to offer alternative solutions to them. My name is Oluwafumito Adeleye and I am with Diaspora Solution Group, a non-profit organization with its headquarters in the United States, California and Seattle, Washington. We are on the show today and we'll be looking at a very beautiful topic, and with me in the studio I have Ajia Ramalifa.
Thanks for joining us.
You're welcome. Alright viewers, we'll be looking at the topic that is mental health and substance abuse prevention in Nigeria. What exactly is mental health and substance abuse? Well, this represents critical public health issues that significantly impact individuals, families, and communities across Nigeria. Despite the increased recognition of mental health as a vital component of overall well-being, Nigeria faces numerous challenges in providing accessible, effective, and culturally sensitive mental health services. Okay, the burden of mental health disorders and substance abuse is seen by factors such as stigma, low awareness, inadequate policy implementation, and limited resources for treatment and prevention. Now, we must know that substance abuse includes alcohol, cannabis, and other illicit drugs, and it is rising among Nigerian youth. And this has contributed to a host of social, economic, and health problems. Now, addressing these issues requires a comprehensive strategy that encompasses policy reform, community engagement, and capacity building, and also public education aimed at reducing stigma and promoting early intervention is very crucial. Now, given to the social, cultural dynamics and resources constraints that we have here in Nigeria, it has tailored to the prevention and of treatment and programs, and this is very essential. Now, learning from successful models and integrated mental health and substance abuse prevention into primary healthcare systems can help bridge existing gaps. Now, to strengthen efforts in this area is not only vital for individual health, but also it fosters resilient and productive communities, and also reduces the long-term societal cost which is associated with untreated mental health and substance abuse condition. Now, we have a prominent individual in the studio with us that is going to do justice to this topic. Joining us on the show today, we have Pastor Anthony Chibweze. He is a dedicated nutritionist with a master's degree in health planning and management. His career has spanned over 2 decades, and this has reflected in deep passion for humanitarian services, particularly in supporting underserved and vulnerable communities. Now, Pastor Anthony's journey began in the national primary healthcare sector of the Nigerian Ministry of Health, where he spent 12 years working tirelessly to improve the health outcomes of rural populations. His expertise was further recognized by international organizations such as UNICEF and the World Health Organization, WHO, for which he served as a consultant, providing strategic insights and hands-on support in critical health initiatives across Nigeria. He has a Chartered Fellowship Award as an eminent peace ambassador by the International Association of World Peace Advocates, United Nations Peace Volunteers. Now, in Gambia, Pastor Anthony served as a program officer for the National Nutrition Agency, contributing to significant national health improvement. He has also taught community nutrition at the University of the Gambia, where he played a pivotal role in shaping the curriculum for the Bachelor of Nursing program. Now, pastor, was driven by his observations of the mental health challenges faced by women and children in rural communities. Now, Pastor Anthony led the construction of 2 solar-powered water projects. These initiatives not only provided essential resources, but also alleviated the psychological burden associated with long treks in search of water. Well, Pastor Chibweze, thank you for joining us on the show today. We really appreciate you, sir.
Yeah, thank you very much, and thank you for having me.
You're welcome, sir. We would like to know your view and your opinion on the topic that we are looking at today, which is mental health and substance abuse prevention in Nigeria. So, sir, I'd like to ask you that at what level do we look at if someone is not mentally stable?
Yeah, thank you very much for your question. I will want to address it from the very perspective of beginnings. I call it, you can choose you. In mental health scenarios, it's important the individual decides to choose himself. Self-care is a very important mindset we should develop as a nation and as individuals to be able to take care of us. You see, the nature of our system is that we can take care of our cars, we can take care of our homes, we can do a lot of things, but we don't choose taking care of, we don't do self-care. And when you do self-care, you begin to address intentionally the mental health challenge. So it's something that starts from the very beginning of policy, the very beginning of families, the very nuclear level of community participation and involvement. It's a concerted, unique kind of effort to make it achieve the ideology of choosing you, like I just said. So the starting point in mental health intervention is the individual choosing himself to say, hey, I need to tell myself the truth about me, and then I need to do something about me, and that makes a whole lot of difference because it will. They say necessity is the mother of invention, and when you notice that there is some things about me that is not adding up, that needs help, I can now begin to look for help. But if I'm in denial and I'm just trying to pretend that it doesn't exist, it's not a realistic thing, you will see that the mental health scenario will continue to go into a pandemic level. Where a lot of people will not be operating at their maximum potential because of some issues on their mental health. The major challenges faced in the effective implementation of mental health and substance abuse prevention programs in Nigeria.
So, all right, Pastor, I would like to ask you that there are some major challenges that is being faced in implementation of mental health and substance abuse. I mean, there are programs that are being done to prevent substance abuse and intake in Nigeria. So, what are the major challenges that is being faced by organizations bringing about this implementation?
The effective implementation of mental health and substance abuse prevention programs in Nigeria are faced with several interconnected challenges. And as I try to address these challenges, I want to say something about facts about substance abuse and its implication to mental health issues. The first fact is that any kind of vapes contain arsenic, lead, nickel, and other heavy metals that are toxic No amount of it is safe.
Okay.
That's a very important information because people just say that in the night. So it doesn't matter, it is a vape. No, you are just destroying your lungs. You are shooting yourself on the leg. So I don't think it's right. It's good we know about that. And then the second fact is that lithium batteries in vape devices can explode and cause severe injury. And the third fact is that vapes include benzene, a common chemical in car exhaust.
Okay.
When people start taking in carbon monoxide as a way of, instead of taking oxygen, it's a problem already for their lungs. The tendency of developing thoracic cavity cancer is high. So it's important we know some of these facts as we discuss the challenges. Also, it's important to also point out that cannabis, or the one we call marijuana in vapes, cause damage to lungs and may affect the developing brain. You know, so having said that, when we look into the challenges that I say that are interconnected, challenges that mental health and substance abuse prevention programs in Nigeria have. One of those challenges is what I call a shortage of skilled personnel.
Okay.
Shortage of skilled personnel.
Okay.
Acute scarcity of mental health professionals, psychiatrists, social workers, and counselors is very critical. And then, according to WHO, Nigeria has, less than one psychiatric per 1 million people. So you can see that the ratio is so inappropriate, and then there is a one professional pursuing 1 million people to attend to. So it's not balanced at all. So most mental health professionals are concentrated in urban centers or urban areas, leaving rural areas or regions underserved. Very critical challenge also. Outside the shortage of skilled personnel, you also see that there is limited funding and resources. Inadequate government investment in mental health and addiction services. In fact, less than 5% of our total health budget, goes for mental health, and it is very, very inappropriate because today we see young people. Before we think, oh, maybe when people get old and maybe dementia sets in, no. Today we see young people, youths, 20 years, 25 years, having mental health challenges because of some choices they made or some wrong choices they made, regarding substance abuse. So there is need for increased investment in this sector. Also, stigma and cultural beliefs. This is what makes our communities to be in denial that it's not existing. And mental health and substance abuse are often misunderstood, seen as a spiritual problem, moral failure, or family disgrace. So those stigmas, it creates a high level of stigma in communities, and people now hide their family members that show signs of, mental health challenge. They just hide them because they don't want to put a stigma on the family, and it will affect them having suitors, as the case may be, or even marrying somebody in that family. They will say, oh, these people, they have a tendency of mental health, and the stigma is there, blacklisting that family in social distribution of things. So that stigma is a major challenge that needs to be addressed via what I call keep talking.
Keep talking.
Parents, teachers, and adults. Keep talking. Keep talking. When we give the right information to our population, people begin to develop the right attitude, the right mindset towards the elimination of these stigmas and show the necessary empathy needed by such claims. Another challenge I also want to point out is poor policy implementation and weak governance. Nigeria has a national mental health policy, but implementation is weak and poorly monitored. So mental health acts are only passed was only passed in 2021 after decades of using outdated colonial era laws.
Okay.
Inadequate coordination among agencies and limited political will to enforce reforms. So these are very critical issues regarding governance in this sector, poor policy, and then the fifth challenge, like I also say, is lack of public awareness and education, limited public knowledge about mental health and drug use prevention. Few schools, based on community awareness programs to educate youth and families. That's very high inadequate education strategy, intentionally driven to reach out to the vulnerable population. So we need to improve that education lapses. And then widespread drug availability and youth vulnerability. The drugs are not very, very available as at we needed, and then the youth unemployment and poverty increase vulnerability to use these drugs. Easy access to substances like cocaine, codeine, trimodal, cannabis, and all these horrible substances. When we are instead of communities letting them to know, hey, this thing can destroy your next level.
Okay, Pastor. Thank you. God bless you.
These challenges that are so numerous, but I believe that as we begin to talk about this issue, our communities will begin to know, our government will begin to know, and begin to know how to cross our T's and dot our I's. And then, of course, we have not even talked about urban, rural disparities, where there are many professionals that can handle these cases in the urban sector, while the rural sectors are left behind. Inadequate collaboration between, states and stakeholders.
Yeah, Pastor Antonio, thank you. God bless you, sir. Sincerely, you really do justice to this topic. But can I please ask this question from you? How can we go about it? How can we leverage with the global organization?
Yes, because
they are well
we
trained
need
enough
to
this.
Talk about that.
How can Nigeria do that?
Yes.
One of the recommendations I have from my experience here in the States is that the government must improve the funding and dedicated budget lines for mental health. It's an intentional act. When we do that, like what they did in my state, in Washington State, in USA, here in Seattle precisely, they improved on the mental health budget because they found out that it was becoming a pandemic in our system here. So one of the interventions the government did was to improve the budget, and also the next thing we did also was training and recruitment of mental health professionals. Population of mental health professionals are very, very low compared to the people that need the service in Nigeria. 1 is to 1 million is not gonna work out. We have to redress that issue by improving our health sector training system to generate more volunteers, more trained professional psychiatrists that can help us. And then the next thing I want to suggest also is public education campaigns to reduce stigma. We have to start from grassroots in I call it community participation, mobilization and involvement. We mobilize the community, they participate and they get involved to know that stigma is not the way out. When you stigmatize a family, you just take them backwards, you don't move them forward. But if you can help them in their peculiar challenge, it will help the system. So one of the interventions the government did was to improve the budget And also, the next thing we did also was training and recruiting or recruitment of mental health professionals. Do a lot of public education and awareness on that area. And we must start from the grassroots up, and then in the planning of the implementation, the grassroots must be involved.
Yes,
if we don't get the grassroots involved, they will tell you it's just like somebody coming from the peak to come and do something at the grassroots. They will feel they don't have ownership. They are not involved. It's your program. But when you involve them from planning to implementation,
they want to
they
lift it up.
Take it up and go the next mile.
Okay.
It's also important that we public health or public education campaigns, I've said that, and community-based interventions and school programs. We will intentionally work on the curriculum of our schools. Let them know, see how we can incorporate mental health and substance abuse information from the school curriculum, so that as they learn it, our children, our youth begin to be informed early, and strengthen policy enforcement and monitoring. Of course, improve data collection and research and monitoring and evaluation. This, I believe, will help the system to be organic and evolve some solutions that can make us better in addressing the mental health challenge in Nigeria, and equally the substance abuse issues.
Thank you.
And we will not forget to mention the relevance of government in making sure that these substances that have been abused are not found in our streets. We must make sure we don't have things like fentanyl. We don't have things that we destroy our people and make our future bleak. We must make sure to use the law enforcement system to make sure that these drugs are not found everywhere, where they are not supposed to be found.
Pastor Anthony, sorry please, front up please. Pastor Anthony, can you please in a short word help sensitize our community leaders or maybe people in our community to please stop stigmatization for repentant of substance abuser and mental health people, please?
Yes, I will want to encourage our communities to, like we can start in our local governments to look out for our chiefs, like we have the various traditional rulers in our communities. Like in Nigeria system is a very wonderful cultural system. So when their chief or their king says something, it makes a lot of impact. So if you can mobilize such opinion leaders in communities and use them as, change agents in their communities. And then they can easily talk to their other chiefs, and the other chiefs will talk to the women, the children, the youths, and before you know it, our change in mental health and substance abuse framings will evolve naturally from the local levels, and that makes impact and of course affects our national levels.
Thank you.
So I believe in if we can mobilize these leaders in the grassroots, it will make a lot of impact in the short run.
Yes. Thank you very much, Pastor. This topic is a very, very wide topic, but the time will not permit us to keep talking. But I'm sure when we call on you next time, you will surely oblige us. Thank you for joining us on the show today, Pastor Anthony. We really appreciate your presence. Thank you. And Ajia, I'm sure you will agree with me that there should be easy access to healthcare services concerning mental health here in Nigeria. Yes.
More sensitization about it as well.
Yes.
Thank you.
Thank you, viewers, for joining us today on this show. I would love to hear from you as usual. And thank you so much for always following us, sending your comments and sharing our page on your social media handles. We really love to hear from you once again. And on this note, we want you to join us same time on this same dial. Bye-bye.